You don't make me mess.
Hi, I'm Dr. Andrews, a medical practitioner in Ghana. I'm coming your way once again with another exciting episode on our health YouTube channel. And if you haven't liked or subscribed yet, we would kindly ask you to do so for exciting content henceforth. Now, today we are taking a very important subject to discuss, and it is the greatest asset in the life of any individual. What we've realized over the years is that most people think about assets as only the land that they are having, their businesses, their family, their children, and so on and so forth. But here, most people forget about the fact that their greatest asset is the health that they are having. If you have good health, if you are living well, if you have all your organs stable, if you are living without any form of pain or any ailment. So first look at assets. What is an asset? An asset is anything that is useful or valuable that always adds something to your life and not coming to take something away from you. So here is it. Our health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So what every individual is supposed to be doing is to ascertain all his or her assets, know which ones are bringing the greatest of return on investment, and rather get there and invest in it. Now, one of the assets we are going to talk about is our health as our prime asset. Looking at our health as our prime asset, how are we going to invest in it to get the most of it? Now, the first thing to do to invest in your health is to increase your knowledge on health. When it comes to health, you should not be oblivion, you should not be left in the dark, you should be enlightened so that you will get the best out of your health. What are some of the things you are supposed to be looking at? You should be looking at how to live healthy, how to exercise your bodies, how to drink good and adequate water to hydrate your body, how the fruits that you are supposed to eat. All these things adds up to your knowledge, the level of knowledge you have to get when it comes to your health. Another thing you are supposed to know is that what are the things I'm supposed to avoid? Junk foods, you are supposed to avoid them. Eating late at night, you are supposed to avoid them. Stressing your body so much that you have no rest, you are supposed to avoid them. So you know what to invest in, as in how to live well, and then what to avoid to also be able to live well. Now again, you must increase your knowledge when it comes to your family history trends, the medical history in your family. Some people are in families where breast cancer is prevalent. We have kidney stones, kidney cancers, prostate cancers, and all these kind of things. So if you know your father or your uncle, your mother, or your auntie, your grandmother, your grandfather is having such a disease condition, increase your knowledge there, because you are at a higher risk of getting that disease. So if you know the risk factors associated to that disease condition, you are likely to overcome it and you would escape that disease condition. So it's one of the things that you can do to invest in your health. Now, if you have any disease condition, if you have been diagnosed of the disease, or you are experiencing some symptoms in your body which has been there for quite a while now, one of the things is that you must get knowledge concerning that symptom or the diagnosis that has been made. Don't leave it to chance. Don't leave it to only your doctor to prescribe medications for you and to tell you what to do and what not to do. You must take a proactive step to know something about the disease and how to overcome it as soon as possible. The next thing you can do to invest in your health is to take an action step. Most people have a lot of knowledge about their health. They know what they are supposed to do, what not to do, but they practically do nothing to ensure that the knowledge is put to the rightful use. One of the things that you can do is that you must make a plan. Create a health plan right from today as you are listening to me. Make that plan and change your lifestyle, modify your lifestyle. Live the way you were living before this knowledge came to you. Something must change about you. The first thing is that create a plan for your life, a healthy plan. That, I'm going to sleep at this time, wake up at this time. Have enough rest. One of the things you can also do is to go for routine checkup. At least every 3 months or at most 6 months in the year, you go for one checkup. Then in the second half of the year, you do another checkup. These are measures you put in place to make sure that you are really investing in your health. Another thing you can do is to also decide from today that you're not going to take any medication that has not been prescribed by a medical practitioner. Most people buy over-the-counter medications, any medicine at all, any decoction, and then they begin to drink it. At the end of the day, they have problem with their liver, their kidneys, and whatnot. All these things are things you are doing to make your health a liability to your own. So make it a point right from today that you're not going to get any medication that is over the counter, or you're not going to get any medication without a prescription by a medical practitioner. If you're able to do this, you are really investing in your health, and your health will never become a liability to you. The third way to really invest into your health is to develop your relationship with a health worker. It can be your doctor, it can be a nurse, it can be a pharmacist, it can be a lab technician. No matter who the person is, it is an opportunity to get closer to them. Now, no matter how careful we are in this life, there are always emergencies. There could be times where you may not be feeling well, your daughter may not be feeling well, and at that point you wouldn't know what you are supposed to do. But if you are so close to any of these health workers, a call away and you will get them. They will show you what to do. They will give you their counsel before you even get to the hospital. It is very, very important. Make sure you have at least one doctor's contact on your phone, one pharmacist's contact on your phone, one nurse's contact on your phone, and make good use of it. Don't wait till there is a problem before you now call them. It will be a burden. But now that you are free, there's nothing wrong, call to check in and build that rapport with them so that at the point of your need, you can always fall on them. The fourth thing you can do to invest in your health is to apportion some resources down for health emergencies. And by estimation, it's not less than 3,000 of any currency. Not less than 3,000 of any currency. Just put that amount of money down to handle any emergency. Now, something like a cancer in the body, when it's developing, you would not know how it will develop. You would not know when it will start. Before you realize that's come up, the diagnosis is clear, the symptoms are also clear, but the finances to be able to curtail this problem will become now a problem. But if you have some money apportioned down for emergencies, that's the best thing you can do for your health. So in all your spendings, in all your gettings, in all your runs, make sure you have apportioned an amount of money down for your health. Now, aside apportioning some amount of money down for your health, you can also go for insurance policies that will cover your health. Most of the times, you don't know the kind of disease that may be coming. Either it's an acute disease or a chronic disease. All you know is that it has come. And some of these insurance policies covers all our health needs and is the best thing to do. So if you are working, you have a lot of money now, you can subscribe to any health policy that will take care of your health emergencies. The fifth thing you can do to invest in your health is to trust but verify. I'm repeating it again. To trust but verify. One of the things is that we have hailed doctors as people who cannot make mistakes, but they do. Doctors are not euphonic beings, they are just humans as we are. They also make mistakes. You go to a hospital and you are diagnosed of a terminal disease, or you are diagnosed of any disease at all. One of the things that you can do is to verify the result. You can go elsewhere to another laboratory and to investigate into it to see if it is true. It is very important. I've come across cases where people have been put on ARTs. People have been put on ARTs without even having HIV in the first place. So you must trust the result but verify. If the doctor prescribes any medication for you, you can also read something about the drug that he has been giving you, the side effects, and discuss it with your doctor to make sure that what you are actually going to take in is something that is so healthy for you and that is meant for you. Mistakes do happen. Doctors will prescribe the medication, but the pharmacist will give a different medication, or the dosage will be changed. So as one of the ways to invest in your health is also trust the doctor, trust the health provider, but verify whatever they have given you. Your bonus point for investing in your health. One of the ways to invest in your health is to have routine lab checks. These are the labs that you can do on any routine checks that you are going to do. One is urinalysis. You can do full blood count. You can do liver function test, kidney function test. You can check for cardio biomarkers in your blood. You can do PSA, and you can also have ECG done for your heart, and you can do abdominopelvic ultrasound scan, which will also show the internal organs in your abdomen and in your pelvic region. Thank you so much for the time spent with us. We know you have enjoyed the section so much. If you haven't liked, subscribed or shared, you can use this opportunity to do it till we meet same time again. It's bye for now.